I'm at City of Hope National Medical Center in Duarte, California, and I'm here with Dr. Michael Caligiuri, who is the president and physician-in-chief here at City of Hope. We're going to talk a little bit about precision medicine. It's shifting from 20, 30 years ago, where there were a few drugs and we knew of a few cancer types. In the future, what is it going to look like?
As a treating physician, there's probably hundreds of targets that are what we call druggable, meaning, hey, if I have this mutation in my cancer, maybe I don't get a standard drug regimen, maybe I get a targeted therapeutic, or maybe I go on a clinical protocol. And so knowing what to do, even if there's just 200 that are druggable, knowing what to do for each cancer, when and where, is becoming overwhelming when you've got 20, 30 patients in your clinic.
Yeah, so how do doctors keep up with it? How?
Well, the data thus far that we have and others have, they're not, frankly, they're not keeping up. One, it's knowing which test to order. And that's only a fraction of our, of doctors practicing in a typical community setting. And then two, how to interpret the test.
Right.
But if you're in practice and you're really trying to figure out what test do I order, how do I order it, and how do I interpret it, that's no more than 20% of all practicing communities physicians who are really, as you say, out on their own and not really strongly affiliated with an academic medical center like City of Hope. So it's quickly becoming and has become overwhelming, because today it's only in a small fraction of patients that are going to have these. But of course, if that small fraction is you, and you have to take a pill instead of 4 drugs, chemotherapy and radiotherapy to get your tumor shrink, you can just take a pill. I want that test done, and I want to know that it's interpreted properly.
Well, we appreciate the partnership that we have with City of Hope, and I think part of what led to this collaboration together was some of the trends that you've just spoken to and what's happening.
Yeah, one of the things that happened at City of Hope is we realized that we need better integration on the precision medicine strategy. So having mechanisms to quickly educate and to make sure that we're all doing things the same way, whether a patient is seen here in Duarte campus or whether the patient is being seen at at one of our sites out in the community, is very, very important to us. The quality has to be the same. And so, developing methodologies to do that has been at the heart of what we want to do and led to our getting to know one another.
Good. Well, thank you again for this time, and thank you for the your leadership, because there are a lot of people today in cancer centers around the country who are looking for solutions in this area, and appreciate the fact that you are leading and helping to lead in this. And we look forward to working together as we continue on in this.
Pleasure, Clynt. Thanks very much.
Thank you.
All right.